Etoposide Vial is a medication used to treat testicular cancer and certain forms of lung cancer, such as small cell lung cancer. It works by slowing the growth of cancer cells. It is important to take this medication as prescribed by your doctor and to follow their instructions carefully. The dosage and timing of taking this medication will vary depending on your specific condition and medical history. Be sure to discuss the best time to take this medication with your healthcare provider. When using Etoposide Vial, it is important to follow the instructions given by your doctor or healthcare professional. This medication is administered through a slow injection into a vein, typically over 30 to 60 minutes. The frequency of the injection is usually every day or every other day, for a total of 3 to 5 doses. This cycle may be repeated every 3 to 4 weeks. It is important to note that this medication may cause low blood pressure, so if you feel dizzy, it is crucial to inform your doctor or healthcare professional. They may need to adjust the injection or slow down the administration. The dosage of Etoposide Vial is based on your medical condition, body size, and how you respond to the treatment. Your doctor will regularly monitor your blood counts to ensure that you can continue with the next cycle of treatment. It is important to keep all regular medical and lab appointments to ensure the effectiveness and safety of the treatment. Side effects of Etoposide Vial may include nausea, vomiting, diarrhea, dizziness, tiredness, weakness, changes in taste, loss of appetite, and pain/redness at the injection site. Your doctor may prescribe medication to prevent or relieve nausea and vomiting. Eating several small meals, not eating before treatment, or limiting activity may help lessen some of these effects. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Temporary hair loss may occur, but normal hair growth should return after treatment has ended. Pain or sores in the mouth and throat may also occur. It's important to brush your teeth carefully, avoid using mouthwash that contains alcohol, and rinse your mouth often with cool water mixed with baking soda or salt. Eating soft, moist foods may also be best. There are also more serious side effects to be aware of, including numbness/tingling of arms/legs, sudden vision changes, eye pain, stomach/abdominal pain, yellowing eyes/skin, dark urine, painful/difficult swallowing, and redness/swelling of your veins. This medication may also lower your ability to fight infections, so be on the lookout for signs of infection such as a sore throat that doesn't go away, fever, chills, or cough. It's important to monitor for any potential side effects while taking Etoposide Vial, and to seek medical attention if you experience any serious allergic reaction symptoms, such as rash, itching/swelling, severe dizziness, trouble breathing, fast heartbeat, or seizures. If you notice any other effects not listed, contact your doctor or pharmacist. This medication can cause serious blood and bone marrow problems, leading to low red blood cells, white blood cells, and platelets. This can affect your body's ability to stop bleeding or fight infection. If you experience unusual tiredness, signs of infection, like a persistent sore throat, fever, chills, or easy bruising/bleeding, such as black stools, bloody vomit, contact your doctor immediately. Before using Etoposide, make sure to inform your doctor about any allergies you may have or any other medications you are currently taking. It's important to discuss your medical history, including any blood, liver, or kidney problems, as well as any previous radiation or chemotherapy treatments. Etoposide can increase your risk of getting infections or make current infections worse, so it's best to avoid contact with anyone who has a contagious illness. It's also important to let your doctor know if you've been exposed to any infections recently. Be cautious with sharp objects and activities that may lead to injury, as Etoposide can increase your risk of bleeding and bruising. This medication may also cause dizziness, so it's best to avoid alcohol and marijuana, and avoid driving or operating machinery until you know how this medication affects you. If you're using Etoposide, it's important to limit your alcohol intake to reduce the risk of stomach bleeding. Additionally, be sure to inform your doctor or dentist about all the medications and herbal products you are using before undergoing any surgery. It's important to note that children and older adults may be more sensitive to the side effects of this medication, and it may also affect fertility in both males and females. If you are pregnant or planning to become pregnant, it's crucial to discuss reliable forms of birth control with your doctor, as Etoposide may harm an unborn baby. Lastly, etoposide passes into breast milk and is not recommended for use while breastfeeding. Be sure to consult with your doctor before breastfeeding if you are using this medication. When taking Etoposide Vial, it's important to be aware of potential drug interactions. These interactions can affect how well your medications work and may increase your risk of experiencing serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share this list with your doctor and pharmacist. It's important to not start, stop, or change the dosage of any medicines without your doctor's approval to ensure your safety and well-being. If someone has taken too much Etoposide Vial and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. Remember to schedule regular lab and medical tests while using Etoposide Vial, such as complete blood count and kidney/liver function tests. It's important to keep all medical and lab appointments and consult your doctor for more details. Etoposide Vial is typically administered by a healthcare professional in a hospital or clinic setting. The dosage and frequency of Etoposide Vial will be determined by your doctor based on your medical condition, response to treatment, and other medications you may be taking. Be sure to follow your doctor's instructions carefully. Etoposide Vial is usually given once every day for 4 to 5 days in a row or as directed by your doctor. The optimal timing for taking Etoposide Vial will be determined by your healthcare provider. Make sure to take each dose of Etoposide Vial as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to determine the best course of action. Be sure to follow the product instructions and consult your pharmacist for the proper way to store Etoposide Vial. It's important to keep all medications out of reach of children and pets. When it comes to disposal, do not flush this medication down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.